We're glad that you're here and we're excited for tonight's presentation. Tonight we're going to be discussing biofilm basics, but make it brilliant, elevating your oral hygiene tools and strategies. Our first presenter of the evening is Haley Haffaday, one of our very own Social 630. She's here with me. And then Sarah Jackson is going to be presenting the second half of our presentation. She's with CureProx or Curaden USA. And she's going to be really driving home the oral hygiene tools and strategy portion of tonight's presentation. So we're really excited to hear from her. All right. So before we get too far along, I'm just going to give you a little bit of background on Haley and Sarah and kind of what they're bringing to the table tonight for tonight's presentation. Haley earned her bachelor's degree in dental hygiene from Eastern Washington University and began her clinical career at Dove Family Dentistry in 2021. She is committed to creating a comfortable and positive dental experience and is passionate about educating patients on the essential link between oral and systemic health. In addition to her clinical work, Haley plays an important behind-the-scenes role with our Dental Hygiene Society at the Social 630, which is where we all are tonight. And she helps us support our continuing education experiences and support our community. Her dedication reflects the spirit of our entire dental hygiene team at Dove Family Dentistry, and we couldn't be more proud of her tonight. Sarah is the head of education and professional relations for Curaden USA. Over the past 25 plus years, she has held various roles within the dental team, including dental assistant, front office staff, and dental hygienist. Sarah is a professor emeritus at Eastern Washington University, where she served 20 years, ultimately as a tenured full professor and program director. Sarah is a researcher, published author, international speaker, and active leader in the association. As a health and wellness advocate, she co-founded the Abundant Life Wellness Hub to help others live abundant, healthy lives. Sarah strives to inspire positive change among oral health providers worldwide. As a certified instructor with Curaden Academy, Sarah is dedicated to advancing the mission of ITOP, individually trained oral prophylaxis. She aims to empower dental professionals to elevate their roles as health coaches, deliver exceptional oral hygiene education, and make a meaningful impact on patients' oral and overall health. So without further ado, oh, actually, you know what? Real quick, I don't want to forget. We want to thank CureProx for sponsoring this evening. We're so excited. We are loving our sweatshirts. I don't know if you guys can see them. They're so fun. And if you're best in chat, you'll have a chance to win one tonight too. So thank you, CureProx, for sponsoring tonight. We're grateful for partners who believe in investing in people and not just products. All right, so without further ado, we are going to turn the time over to Miss Haley Haffaday. She is going to fill us in on all things biofilm basics tonight as we get started here.
All right. Hi, everyone. Thank you so much for having me on tonight. I'm so excited to present on biofilm basics, but we're going to make it brilliant. Just a little disclaimer before we get started. I have no financial disclosures, conflicts of interest related to the content. I have not received any financial compensation or support for any of the topics discussed, and I do not have any paid affiliations with any companies for research or monetary purposes. And before we start, a few learning goals just to start us off here. There's going to be 5 parts to this teaching. We're going to go all the way back to biofilm fundamentals, and then we're going to really emphasize the importance of daily at-home biofilm disruption for overall and oral health. Thirdly, we are going to identify tools that help support effective biofilm control, and Sarah will be speaking more on this in the second part of the presentation. Number 4, developing personal OHI strategies to best suit your patient. And lastly, integrating new approaches to enhancing patient engagement and adherence. All right, so if you guys were here for our last Social 630 presentation, you may recall the different learning styles that Heather talked about. And as you can see, I'm a visual learner, so you will see a lot of photos throughout this presentation. So to really go back to the basics, I created a simple equation using photos. And before I really get started talking on this, something that I love about the dental hygiene profession is that we're always learning, and there's always new technology and there's always new things that are coming up. But sometimes we forget we need to go back to the basics and really ask ourselves, what is biofilm? How does it form? And what does that mean for me as a clinician? So with this visual equation, um, you can see on the far left side, there's a photo of some bacteria. And while there are more than 700 different types of bacterial species identified in the oral cavity, each person typically has 1 to 200 different types of bacteria in their own personal oral microbiome. Some species are permanent residents, while some are only there for a short time. They're more transient. So if we get bacteria and we add moisture, this creates the biofilm byproduct. And this is, when combined, is creates a susceptible host. In this case, it's your teeth, tongue, cheeks, palate, and saliva. And once we get the biofilm adherence in the host, we get biofilm. So we get that adherence, which we see when we disclose patients. And we all remember learning about the biofilm life cycle in school, but do we remember each stage? I know I didn't, but we're going to go back. So the first stage happens right after the biofilm byproduct finds a host and adheres, just like we talked about on the last slide. So the single bacteria meets up with the other bacteria and they eventually form the microcolonies. We can kind of see through those photos there on the right. But really the question is, what drives the microcolony dispersion? Number one is nutrition or nutrient and oxygen availability, depending on if the bacteria need oxygen or lack of oxygen. For instance, deep down in those perio pockets, we're not going to have as much oxygen. And so there's going to be those bacteria that don't need the oxygen molecules. And this could also mean that there's a pH change in the oral cavity. So like if we eat something acidic, obviously it lowers the oral pH and the bacteria is going to disperse so that it can digest those sugars that have entered the environment. Number two is nitric oxide. Bacteria also disperse because of either the presence of nitric oxide or lack thereof. So think of those patients who mouth breathe, and when they're mouth breathing, they're decreasing the amount of nitric oxide, but the plaque levels are also increasing because of that. There's also a mechanical and physical factor. So brushing, chewing, flossing, water picking, that causes the manual disruption of biofilm so that it actually disperses. And if we look at the photo on the far right, it really shows the complexity of biofilm with all its layers. There's a lot of layers when it comes to biofilm. And you can see at the bottom, it's called the plaque fluid layer. And that sits right underneath the biofilm and the tooth. And a really interesting fact about the plaque fluid layer is that the pH significantly drops in this area, which is why using pH strips solely to test the salivary pH isn't actually the most ideal way to test what's going on inside the mouth, when we actually really want to know what's going on right next to the tooth. All right. So this is a fun slide. We have two environments and two different stories. So we have plaque fluid and we have saliva. Both of the composition for each of these is mostly water, but plaque fluid is mostly polysaccharides, short chain fatty acids, and glycoproteins, where saliva also is composed of not just water, but electrolytes and proteins. And then we already talked about the plaque fluid being that inner layer between the biofilm and the tooth surface. And the closer we get to the tooth, the more complex the environment. And that's really the big thing I want to hit on this is the complexity of all the biofilm and what goes going on inside the mouth, because the biofilm is really smart and it pulls in and pushes out nutrients to metabolize them, and it kind of picks and choose what it wants. And so that's why we need to be really smart on products we use and how we disrupt the biofilm. And so the big difference between the both of them is the pH and what changes the pH. So for plaque fluid, fermentable carbohydrates are a big one, and this is really when the sugars and the starches are broken down by bacteria, and this causes the rapid pH drop. And foods typically that are higher in glycemic index often lead to a more dramatic pH decrease. Second, microbial composition. Specific acid producing and acid tolerating bacteria will also decrease the pH. We all know that saliva acts as a buffer in the mouth, and this also can reduce the saliva based on if you have a patient with dry mouth or different kinds of medications and things like that that are contributing to the xerostomia. Metabolite clearance is another one. This is the rate at which the bacteria produce acids and how fast they're cleared or neutralized by the saliva effects at the pH level. And the last one for plaque fluid that can change the pH is urea and other compounds. And this is just a continuous supply of urea that can raise the resting pH to above 7. And the other factors include the calcium and phosphate concentration in the saliva, which affects the critical pH threshold. So similarly on the pH side of saliva, diet choices are really the main factor in the pH change. So soda, coffee, alcohol, citrus fruits, these all directly lower the pH. And then the sugary foods that we eat can also directly feed the bacteria that produce the acid. Salivary flow rate, similarly with plaque fluid, just the decrease in saliva production can lead to a lower pH. Tobacco use, smoking, chewing tobacco, nicotine, things like that also can reduce saliva flow. And this can introduce different chemicals that can create that more acidic environment. And then we have oral hygiene and bacteria. Poor oral hygiene allows for acid-producing bacteria to thrive, and this also lowers the mouth's pH. Metabolic and biological factors, so different health conditions of patients, stress, age-related changes, these can also alter saliva composition. And then lastly, just the time of day and activity. Saliva varies throughout the day. When we're sleeping, we usually have a lower flow. And then after meals, just because we're chewing, the saliva is generally more alkaline. So I know we've probably all heard of the game Pac-Man. It's a game where the little Pac-Men are trying to eat all the little yellow dots and not get eaten by the ghost. So if we were to compare biofilm to a Pac-Man maze, it's very similar. It's also very complex. So the biofilm is structured just like this maze. It's very protective. So you see that little blue line that goes around the border. This would signal or symbolize the EPS matrix of the bacteria. So it's like that cell membrane. And the bacteria represents the ghosts. So the red and the pink and the green and the orange little ghosts, those are the bacteria that move within the matrix and metabolize all the sugars. And the yellow dots are the sugars that fuel the bacterial metabolism. So when the bacteria consume the sugars, they produce the acid and the pH drops. And the EPS matrix, so the maze walls, it traps in the acid and it protects the bacteria. And so you can see the ghost and the Pac-Man are trapped inside of the maze. And then the saliva is represented by the Pac-Man. And this is what tries to buffer the acids and wash all the nutrients away. So if the saliva cannot penetrate the thick plaque, the bacteria actually win. And the big fancy word for this is tortuosity, which essentially means all the twists and turns and roadways to get from point A to point B. They have an extreme amount of deviation from a straight line. So it just basically means it's a long way to get a short distance. And this is essentially how a biofilm functions. There's just a lot of channels and directions that need to be penetrated if we're going to actually kill the bacteria. And really the question is, how are we going to figure out the maze to penetrate the biofilm and reach the tooth? So we probably all see things like this on a daily basis, but do we actually know what's going on microscopically? So on the far right, we have a biofilm slide. We love using our microscope in office. And it's one of my favorite ways in conjunction to a saliva test to get a brief understanding as to what we're actually dealing with. So diagnostic testing and microscope slides create teamwork between you and the patient. And really what it does, I've seen, is it creates teamwork between us as a clinician and the patient, and it stops becoming like my patient just isn't flossing, but it's more complex than that. And as we what it really does is it changes an us versus the patient mindset to it's us and the patient versus the problem. And in order to curate a protocol that's really tailored to each patient's home care needs, it's important to get the patient on board and to show them that these are the bacteria that they're dealing with. And we can tell them like, I can do my part, but really it gives them a sense of ownership too. Like, okay, I need to do what I need to do at home and follow these certain instructions to take care of these bacteria. And what I love about the biofilm slides is it shows the patient the activity and the motility of what's going on inside their mouth. And when we use it in conjunction with salivary testing, it shows more of the severity. And so again, it just really creates that personalized treatment plan that reinforces that we want to work with the patient, not against the patient. The bacteria that we deal with on a daily basis is aggressive and ruthless, and I know we all know that as clinicians, but I know we all have a patient that comes to mind where they have impeccable home care, they're young and they're healthy, and everything on the outside when we're talking to them, going through health history, doesn't scream, I have perio. But once we start cleaning subgingival air polishing or scaling ultrasonic use, they start bleeding like a stuck pig. And what we're really shocked is someone who looks visually healthy has a dysbiotic microbiome. And it really leaves us wondering, like, where ultimately is this inflammation coming from? Like, what systemically is going on other than what's going on inside of the mouth? So I've got a few biofilm slides to share with you guys, but before we get going on those, I did want to give a big shout out to the queen of dental hygiene herself, Barbara Tritz. She has been just an amazing mentor for us, and she's been part of the Social 630 community from the very beginning, and we're just really thrilled that she's on here tonight, so big shout out to her. But this is a really active biofilm slide. It's got spirochetes, rods, cocci bacteria, and the little dots you'll see, these are visible red and white blood cells. And this indicates that there's inflammation and an immune response going on. So really cool active biofilm slide. And in this video, you'll see we're observing an amoeba with the dental plaque biofilm under phase contrasting microscope. And that large blob you see is the amoeba. And if you look closely, you can actually see part of the white blood cell inside the amoeba. These are found in dysbiotic or unhealthy biofilm. And what they do is they engulf the white blood cells through phagocytosis, and they obtain the nutrients like proteins and iron for energy and growth. So essentially, they just keep getting bigger and bigger. And in doing so, they also eliminate the immune cells trying to attack them and help them survive in the inflamed tissue. And then we've got one more. This is a parasite. You'll see it moving across the screen here. It looks like a little mouse. We saw a parasite our first day of using the microscope in office, and that was pretty wild. They're a little bit larger, independently moving. They move really fast, and they're associated also with unhealthy and inflamed biofilms. But while it's not a definitive diagnosis, seeing them in real time is powerful, and it just helps patient visualize, like, this is what's going on inside your mouth, and why controlling inflammation in home care really matters. So pretty neat on that one. And as we've seen on the last slides, the oral biofilm is a complex protective matrix of bacteria responsible for decay and periodontal disease, but there are several strategies that we can implement to
Yeah,
disrupt
it's a Zoom call,
the
but we're
biofilm and
muted.
reduce the carcinogenic and periodontal pathogens. So really what the foundation for this is mechanical disruption. And we do this every day when we're working. It's your surgery, your piezo, cavitroning, hand scaling, and really just the goal of this is removing physically the plaque and the calculus and breaking up the biofilm matrix. It's really just the essential first step in most adjunctive therapies, and it improves the efficacy of products applied afterwards. So just like your peptides, fluoride, things like that. Moving on to chemical disruption down in the middle here, we've got antimicrobial rinses, molecular iodine, providone, iodine, different oxidizing agents. These all reduce the bacterial load and limit the regrowth of the bacteria. And it works best when the plaque thickness is minimized via the mechanical cleaning. One thing to note is that the overuse of antimicrobials, like many other products, can come at a cost, and we will discuss that a little bit later. There's a handful of natural products on the market. I'm just going to list a few of them. Zinc lozenges spray, xylitol clear spray, xylomelt, cell life rinse. Lastly, we've got conditioning agents, and this is kind of a fun wild card one for chemical disruption. This is our phosphoric acid etch, and we know this a lot in different restorations, so sealants, fillings, and it just removes that smear layer and biofilm layer that protects the tooth, and it allows the product to be fully penetrated into the tooth because it opens those tubules and enhances the peptide absorption and efficiency. And so, like, if we're replacing Curodont, we first, remove the biofilm, either the pumice or the etch, and then it allows the tooth to be susceptible for a better uptake of the product. And then over in the far right, we've got antibiotic therapy, either systemic or locally used. So like your Arrestin or with systemic antibiotics, there is limited penetration into the biofilm, which is why we need to have them, they know the patient come in for a cleaning, so that once the antibiotic is in their system, we disrupt all the biofilm, it goes into their bloodstream, and the antibiotic is able to actually kill that bacteria. And really the best way to figure out which antibiotics to use is salivary testing, just like with all these products listed here. Salivary testing gives you a really good, clear description of what's going on inside their mouth and the products best used to treat them. And then up in the upper right, we've got physiothermal disruption. So these are your LANAP procedures, diode lasers, photomodulation. And really how this works is the heat energy from, or the light energy from the laser converts to heat energy, and it denatures all the bacteria, proteins, and the matrices. So it just helps with inflammation with that. So really a key takeaway from this slide is biofilm management is multifaceted. There's no one size fits all method. There's no single method that's sufficient all by itself. We really just need a combination of each of them, with mechanical disruption being the foundation of that. And this really just goes to show we just really need an understanding of the science behind each intervention, because it allows us to use the right combination. So it just, creates that tailored approach and improves the patient outcome for both caries prevention and periodontal health. And now for the patient's guide to the biofilm battle. One of my favorite parts about being a dental hygienist is talking about home care products. So for at-home chemical disruption, there's quite a variety here. So you see there's a couple toothpaste bottles. We've got Supermouth in that blue one, Dr. Jen's, and Boca. These are all nanohydroxyapatite based toothpastes. And for instance, Supermouth, we really love this one when targeting certain airway bacteria like TF and FN. And I've seen some patients who come back after 6 months using Supermouth, and a lot of their gingival inflammation has decreased because it's targeting those certain bacteria that they've got. Boca, Dr. Jen's also really great. Dr. Jen's extracts the nanohydroxyapatite from eggshells, so it's actually one of the most pure forms of nanohydroxyapatite you can get, which is pretty neat. So the cool thing with nanohydroxyapatite is the particle size is small enough so that it actually can penetrate the biofilm matrix, specifically of the strep mutans bacteria, which is one of the caries causing bacteria. So yeah, and then on the far left, you'll see a silver and green bottle, and this is called Elementa Tooth Gel, and this one's pretty interesting because it's got microcapsules of nano silver particles, and it penetrates the biofilm, but also the plaque fluid layer, which we talked about earlier, where the pH really has that high variability, and it basically tricks the biofilm into accepting it, and so it accepts the little particle sizes, and then it's able to change the pH of the most acidic location in the mouth. So therefore, it decreases the risk of decay, and it allows for the remineralization because of the calcium and phosphate particles. So that one's a really, really interesting toothpaste. And then you'll see some different bottles on this slide. You'll see BioGaia, Probiora, and Burst. And these are oral probiotics, and they work a lot like gut probiotics, where they create just better strains, different strains of good bacteria that essentially just drown out the bad bacteria that's causing inflammation. And just to keep it short and to the point here, Probiora we really recommend for our advanced perio patients. Anyone with a lot of inflammation. BioGaia is really great for our caries-prone patients, people with moderate gingivitis or early perio. And then Burst probiotics are really great for patients who just have low-grade chronic gingivitis or just a little bit of inflammation starting. But really the best way to figure out what probiotic your patient needs and what's going to work best for them is salivary testing, just because these probiotics only target certain strains of the perio and caries bacteria. So and then you'll see Closis and Stella Life. And in the case we do need to supplement with mouth rinses, for instance, if a patient tests with the TD bacteria, we really love Closis, and we love it because it's a stabilized chlorine dioxide molecule. And then Stella Life is also another rinse we love. It's more homeopathic, it's got anti-inflammatory ingredients, but our major implementation with mouthwashes is that we don't recommend them long-term for patients. And the reason why is that they can create resistant bacteria that can be difficult to eliminate. and kind of create a more of like a super bug. So instead, we put our patients on a schedule and a regimen. So typically 10 days on and 2 months off. But I know we all will have patients who ask us, well, what about the minty fresh feeling I get when I switch with mouthwash? And really for that, just have them try some probiotics, because a lot of patients come back after trying the probiotics and they're like, oh my gosh, my breath is so fresh in the morning. So yeah, also electric toothbrush, tongue scraper, just getting all the hidden areas bacteria hides. And another thing to note too is we really try in our office. I know we try to their best to reduce the amount of alcohol-based mouth rinses because they have essential oils in them. And these are great for cleaning your house, but your mouth is a really gentle area, so not so much. It's just a very harsh product for this kind of environment. It also can decrease the nitric oxide in your body, which is linked to high blood pressure amidst other different health concerns. And then moving over to mechanical disruption on the right side here, water picks and inner dental brushes are an excellent way to disrupt the biofilm mechanically, and they've really become the gold standard of at-home interproximal care. CuraProx makes great soft and extra gentle toothbrushes. Really great for patients with a lot of recession. They have a couple different ones to choose from. Mechanical disruption can also be done via expandable floss like Cocoa Floss, David's, Biome. They all make great flosses. And we love tongue scrapers. We love recommending the metal copper ones because the copper element makes it antimicrobial and it actually will kill the bacteria on contact. And then the U-shaped ones also give you just better surface area while you're cleaning. And then in the middle here, we have the Ozone Viajet. And this one's actually a mix of chemical and mechanical disruption because it creates an ozone water out of the tube itself. And so what ozone does is it essentially is O3, so it's got the extra oxygen molecule, and it will help um, kill the bacteria on contact because it's basically oxygenating their cell walls. So yeah, pretty cool. All right, so on to our next slide here. The question we all wonder as hygienists at one point or another is why is there still mature biofilm even if my patient says they're brushing twice a day with an electric toothbrush and doing interproximal care daily? So we already talked about the Pac-Man and biofilm in the architecture of the mature biofilm, and just with how complex it is. You'll see a superhero photo here in the middle, and this just really goes to show when we have thick biofilm, the matrix and the EPS shields the bacteria from mechanical removal and antimicrobial agents. So think of when we disclose our patients, we air polish them, and they still have like that little blue line right at the gum line. This is usually when we need to take our cavitrons out and really clean that and disrupt the biofilm. So then we've got different types of bacteria. We talked about salivary testing and the bacterial diversity and resistant biofilms. These contain different species with variety of survival strategies. So that's why we need to be on our A game, figuring out kind of what's going on inside our patient's mouth. And then you'll see a bear hibernating. Some bacteria enter a dormant state, making them less susceptible to removal. So for instance, if a patient were to be on a mouth rinse for a prolonged duration, those bacteria can create superbugs that build a resistance and just are really difficult to eliminate. And then over in the middle here, we have Gorilla Glue, and we've all seen those gnarly overhangs, abfraction areas. This just encourages biofilm adhesion and it makes it really challenging for patients to get at home. And then also you'll see this X-ray here. Deep pocketing creates localized microenvironments. And so every pocket has its own little neighborhood per se. And so if you do a plaque test and put it under a microscope between say distal of 3 and then the mesial of 25, you're going to get two totally different microenvironments. And the biofilm can actually create really low oxygen environments in those pockets. So even if part of the biofilm is removed, residual bacteria can recolonize within seconds. But really the big takeaway is mechanical and chemical disruption reduce biofilm load, but it cannot fully eliminate mature biofilm at home. It must be combined with professional removal to manage just the persistent biofilm. All right, so on to our next one here. So this one is my favorite slide of our presentation. When I got into dental hygiene school, I knew there was something about the oral systemic link that I loved. And graduating dental hygiene school, I felt like I had just hit the tip of the iceberg. But it wasn't until I started working in private practice when I became more passionate about the pieces of oral and systemic health and how they started clicking and making sense. For instance, why the patient with virtually no plaque had bleeding gums. So when our hygiene team began screening for nasal breathing, tongue ties, sleep quality,
They said
sleep
use the
apnea,
longest one, but
autoimmune flares, diet, bacterial transmission, swallow patterns, it just really reminded me that what we do as hygienists really truly changes lives and it's so important. And the amount of patients that I've had come back, there's three in particular that I think of. And one patient, he came back, he went to go see a naturopath because he had just chronic bleeding gums. And I said, oh, you should go get a blood panel. And so he came back and he said, I went to go see my naturopath. And he was like, my hormones were so off. I got put on a supplement and I totally feel like a different person. He's like, my mood is more stable. And I've noticed a lot less systemic inflammation. And then I had another patient who came in. I had seen his son, and he said that our referral to the ENT because his tonsils were almost touching had changed his life because he had now better sleep quality and his quality of life was a lot better. And then I had another patient who came back and said that they had got a sleep study done and it changed their life and they just feel rested again and feel like they can go throughout their day. So those are just three stories that I have from my patients, but I know a lot of you guys have similar stories. I know our hygiene team collaborates on this often. And really what it comes down to is how can we ask specific questions that reach a root cause issue to not only improve oral inflammation, but systemic inflammation. So to briefly go over each bullet point, starting with health history in the upper left, what autoimmune conditions could be contributing to their gum disease? Do they even know they have autoimmune diseases? When's the last time they've gotten a full blood panel with minerals, hormones, C-reactive proteins, IL markers, or the MTHFR gene? We love referring to any providers that will run complex labs to get to the root problem. Airway health is a really big one. Are we evaluating if patients can breathe through their nose? Do they have a deviated septum? Are their tonsils touching? Are they enlarged? Is one larger than the other? Is there something physically causing them to not get adequate oxygen? Are we actively referring them to an ENT or a PCP? Functional issues. We have a CE course on myo functional therapy in April, so I'll keep this one brief, but are we screening for poor tongue posture, tongue thrust, sucking habits, or tongue ties? And do we know of any myofunctional therapists in the office or in the area? My favorite saying that I heard when we started salivary testing was mothers, lovers, and dogs. And this is how we all share bacteria. So parents can share bacteria when they kiss their babies. You can share bacteria if you are using the same straws, cups, utensils. Spouses and partners usually will have similar salivary test results. And this is why when we usually test a patient in our office, we will ask them if their spouse has been salivary tested, or we'll ask them to get their spouse salivary tested too, because typically spouses will have the same or similar results, and usually one's infecting the other. So if we can, you know, treat them together, it not only helps with provider collaboration, but patient and provider teamwork as well, like we talked about earlier. And then lastly, diet and nutrition. What are our patients consuming? Are we encouraging patients to ultimately fuel their bodies properly and support a healthy gut microbiome? Are we asking our patients if they're eating sauerkraut, kimchi, yogurt, other foods with probiotics in them, or just taking a really good quality probiotic? Are they decreasing sugar and processed foods? A big question recently that we've started asking is the gym goers about pre-workout powders and electrolyte supplements. This could be decreasing the pH of the mouth for the 2 hours they're at the gym, consuming these liquids. And then are we asking people about the LaCroix that they're sipping on all day, thinking it's just a neutral pH when really it's more of an acidic liquid. So really just thinking outside the box with what questions that we're asking our patients to get to a deeper issue. So the next slide here, I've got a fun case study. And this was a patient that I did NSPT on laser therapy. And this is what I saw every 3 months. And, you ask her the home care questions. Is she brushing, water picking, flossing? Like, what is going on? And after a few visits, I something just randomly came into my head and I was like, okay, I remember this book that I read. It was called The Dental Diet by Dr. Stephen Lin. And in there he had something about people who drink a lot of milk will often get a lot of calculus. And so I asked her, I was like, do you by chance drink a lot of milk? She's like, oh my gosh, I love spicy food. I drink milk all day long. And so I asked, so I told her about this book and I said, would you by chance be willing to decrease your milk consumption for the next 3 months? She kind of looked at me like I was crazy. And so she's like, okay, sure. So she came back the next 3 months and this is what we found. A significant decrease in her calculus production, which was awesome. She could not believe it also. And then she was like, oh my gosh, okay, I'm going to decrease it some more. So she decreased it a little bit more. You can kind of see mostly right around the premolars is where she had a lot less of that calculus production. And so a little before and after here, I think is super interesting. This is one of my favorites. Unfortunately, she was really missing her spicy food though and started drinking milk again. So it was a little bit more last time, but that's okay. Um, all right. So just to wrap it up here. If daily disruption is the goal at home for our patients, it's our duty to create an encouraging, honest, motivating environment that fosters patient compliance, starting in the operatory. So we hear stories all the time with patients who say, oh, my last dental hygienist got mad at me. I wasn't flossing enough. And leaving dental hygiene school almost 5 years ago, I made an internal oath to try my best to not make my patients ever feel like I was mad at them. But how do you do that? I firmly believe that encouragement helps foster the growth mindset. And it starts with meeting our patients where they are. So if they say they only water pick once a week, 6 months later, they say, oh, like, I'm not doing as good as I really should be, but I'm flossing or water picking probably like 3 times a week. That's a win. And I feel like we need to celebrate that. And we just need to learn to celebrate the baby steps until we get to our ultimate goal because I think it's the constant encouragement that we give our patients that helps kind of just continue to foster a growth mindset, wanting them to continue to get better and improve and just take those baby steps because they know when they come into our op, they're going to be encouraged and met where they are. For the visual learners out there, disclosing solution has been a huge game changer. And at Dove, we disclose all our patients, and we really implemented that probably 2 or 3 years ago. Um, and so there's a few patients I'll take photos of each time to compare. I have a 12-year-old who's on a 4-month recare, and using the photos has been a huge, huge help for him. And so with this, I'll usually hand the patient a mirror and show them how to see shape, floss, angle, water pick. And I'll show them with the probe um, because it's what I'm measuring when I'm probing. So they need the same angle too in their water picking or how to use interproximal brushes. And this just shows them how they visually can see the plaque being removed off their teeth, which I found to be really motivating for the patient. Another thing that's really helpful is sitting the patient up and having them show me how they floss or water pick or how they brush, and then just make small changes from there. Something that's really important is how we word things. And someone once gave me the analogy of an Oreo. So you know how it's the cookie and then the cream and then the cookie. So thinking of saying something positive followed by feedback and then closing with another positive statement. So for example, I'll ask a patient, hey, like, tell me how you're water picking. Do you watch in the mirror? Do you just run it over your teeth? Do you water pick at a specific angle? And once they tell me if they have an improvable technique, I typically respond with something similar to, it's great that you're moving the water pick slowly, but when you angle the water pick, try to go parallel with the tooth instead of perpendicular. You have the hardest part down, which is doing it every day. You just need to make this little small tweak to the technique. Which I think is just kind of a more encouraging way to just reinforce that they're doing something really well and then just make small tweaks from there. With pedo patients, I love having them feel like they're in charge of making their own goals. And so say if they're, struggling brushing twice a day, we can write out a goal to brush twice a day. Or if they're struggling with interproximal care, we can create a goal of frequency middle ground. So where they are now and then where we want them to be in 6 months and go from there. But really the ultimate goal is finding a product that works for them and motivate and encourage small steps and celebrate the little wins along the way because in a society that's busy and stressful and hectic, we all could use a little encouragement and celebrating when we come into the dental office. So there you have it, Biofilm Basics that make it brilliant. Thank you so much for listening.
Awesome. Thank you so much, Haley. Now, if you have any questions for Haley, of course, drop them in the chat. But you will also have a chance later on. We're going to do a Q&A at the end of tonight's presentation after Sarah is done with hers as well. So feel free to ask or save your questions for the end as well. Now we will hear from Sarah. Sarah, have you unmuted yourself? I'm going to stop screen sharing here. All right.
Yes, looks good. Can you also let me go back and share. Okay. All right. Everybody see that okay? Get it into mode. All right. Thumbs up. Okay. First, I have to say I'm so proud of you, Haley.
Thank you.
Um, Teaching you prevention all those years ago, and look at you now. I mean, you're incredible. So I'm
Thank
so proud of
you.
you. That was amazing. I learned a lot. It was so much fun. So
Thank
I'm
you
so
so much.
excited that we get to do this together. So
Yes,
thank
this is so fun.
It's
Thank
so
you.
such a treat. So just continuing on the conversation with the home care piece, right? So Haley really alluded to that connection and the need for the patient to do their part. And that's really what I'm here to talk to you about tonight. This part of the conversation is going to be about revolutionizing patient education. And that seems like a really big word, like, why do we need to revolutionize patient education? It's just brushing and flossing and basic things. But hopefully by the end of tonight, you'll realize and you'll hopefully agree that there's actually quite a bit that we can do differently. And I love looking at the chat. There's a lot of people on here that were my students over the years. So it's fun for me to be able to reteach people that I taught a long time ago or colleagues that I've known for a long time a new way that I was able to discover in my training in Switzerland. As our Social 630 ladies mentioned, I am the head of education from Kierden. I've been here for, gosh, it's been over a year now. It feels like about 10, but it's been really exciting. I am a certified ITOP instructor from Kierden Academy, and that is where I learned all my training and where I'm going to pass on to you all today. Our objectives, Haley covered biofilm beautifully, so we won't get into that really at all. She did such a nice job there, but we're going to focus mostly on the oral hygiene techniques for patient care. I want you to leave empowered, feeling like you might have maybe a different approach and maybe some different tools. You've already learned a lot of great tools for your toolbox, so hopefully adding to that toolbox by the time you leave tonight. So I'm curious in the chat, and I won't be able to moderate too much, but you all are able to see it on your end. But I always like to ask how many people have actually heard of Keratin or Curaprox products because it's not something that a lot of people have heard of in the United States. So Keratin is actually in 90 countries, and we've only been in the US for about 10 years or so. We are out of Switzerland, family owned, and all the products are Swiss made. So something fun about Swiss products, if you're familiar with like a Swiss Army knife or Victorinox knives, anything like that, everything is really high quality in Switzerland. So being a dental professional for almost 26 years now, I've tried a lot of products, done a lot of, different things over the years. And so it's been really fun for me to be able to try something from Switzerland and see the difference in what products can actually look and feel like. So the fun thing to know is Keratin's not a toothbrush company. So as a sponsor tonight, we're going to talk a little bit about products, but actually won't talk a lot about a lot of our product line. I want to talk a lot more about how we approach home care and how we can change that, how we can make a difference. So the goal is education. We really want to build a healthier and happy society by changing how we do self-care. And it seems like a simple thing, but it's really, really important. So just food for thought, and you're welcome to pop it in the chat if you have any thoughts. But I'm curious, what you think. Why do we need to revolutionize oral self-care? As a dental professional, do you think that what we're doing is working? Do you get done with home care, send your patient home, have them back next time, and they are like on target, they're compliant, they're doing everything you asked them to do, they're healthy, there's no more bleeding. I mean, all the years I've been in dentistry, that was probably one of the most frustrating parts, right? We spend so much time doing all these beautiful things, and then they come back and we're doing it all over again, right? And it's like, okay, why are we not getting anywhere? Why are we not making a big difference? And so that's really the sad truth about oral disease status right now. If you look at the numbers globally, oral diseases we know are largely preventable. And with all the tools and technology, all of the things that Haley mentioned tonight, we have lasers, we have microscopes, we have so many great technologies. Why are oral diseases rising? That's the thing that kind of got me into this whole concept of, what's another approach? What's something else that we can do and change beyond all of these technologies and techniques that we've already talked about today? And of course, it comes down to the oral systemic link. All right. I love that Haley brought that up. It's not just about home care, brushing, flossing. It's about the fact that we know that this biofilm that's in the mouth is going to impact their entire body. And I have to say that the Queen of Hygiene was popping on. I admitted her right after you gave her a shout out. So I'll give her another shout out. She is on today, Barb Tritz. I usually have a beautiful slide next that has your biofilm microscope movement on here, Barb. But since Haley showed all that, I did take that slide out. But we know that biofilm management is important. We know that it's connected. We know that we have to take a holistic approach when we look at dental hygiene, right? It's not just about scraping teeth. So traditional models are failing us. I would say that a lot of dental hygiene programs, and having taught it 20 years at Eastern, I will be the first one to admit that we have not been doing this 100% correctly, especially when it comes to home care. A lot of what we do in dentistry is rooted in treating disease, right? They come in, they have disease, we treat them. We are the prevention specialists, right? That's our job. If you're a dental hygienist on the call tonight, that is your job. We used to tell the students, like, you wear a P on your chest like a superhero. You're the prevention specialist. And so why are we focusing on just cleaning teeth? Right? I don't know if this was around when you were there, Haley, but we started telling students they weren't allowed to say that, right? Do you remember that? It was like, you're not allowed to say that you clean teeth, right? That's been the focus instead of what is the patient doing at home? Are we addressing behavior changes, or are we just scaling, sending them a goodie bag and sending them home, right? And that's something that I think we all have to really take a look at ourselves and figure out, where are some areas that we can adjust. So yes, daily destruction of biofilm. I hadn't even seen Haley's slides, and that's exactly what I had in here too. That is the ticket. And when you look at biofilm under the microscope, which you got to do, and Barb sent me all kinds of videos. I'm obsessed with her microscope videos. Look at these toothbrushes, right? Biofilm is very hard to remove. It's very hard to disrupt. And so when we think about home care, how hard is it for us to actually be effective with this? How much do we really need to focus on it with our patients? And that's going to be the focus tonight. So if we all agree that we do need to revolutionize home care, do things a little bit differently, then how do we actually do that? How do we actually make a difference? Well, I would like to say it starts with mindset. If you were my student in the last, I don't know, probably 5 or 6 years, I taught leadership for a long time. We talked a lot about mindset. So how does it make you feel when you hear, if you're a dental hygienist, for example, that you clean teeth? Do you love that? Do you hate it? Has that just been, kind of your identity? We used to say you're not an oral janitor, right? That is not what you went to school to do. At least I don't think so, right? We went to school for so much more than that. So as dental hygienists, especially, or prevention specialists, or if you're periodontists, specialists that are spending time on education, how much time are we educating versus scaling? What's going to make a bigger difference? If we say we don't have time for education, I think we're missing the point. And when I talk to a lot of dental professionals, that's what we hear, right? And I'll be the first one to admit it, y'all. And I think one of the hygienists I worked with is on the call tonight. There's a lot of time we get busy and patients upside down, and we're scaling and we're saying, okay, I want you to focus a little bit more here with your toothbrush and make sure you're flossing over here. Don't forget to wrap it around like a C. Here's your goodie bag, right? Go home. So what small changes can we do to really make a difference in prevention? What does it actually look like? And how do we motivate our patients? And Haley started talking about that. Sometimes it's just in the way that we talk to them, the encouragement. But we really have to kind of change our mindset on this. I hear all the time now that I've been teaching this for over a year, people are like, gosh, this sounds really great, but I just don't have time. And that's what I want to encourage us all to think about is how are we spending the time that we have? What are the most important steps within that hygiene visit? So I always tell my students, you see your patients every 3, 6 months, once a year if you're lucky. They see themselves every single day, right? So when we think about the hygiene appointment and what we're actually spending our time on, education should be at the top of our list, right? The very, very top of our list. So Keratin Academy launched a whole program that's called iTop. So if you're familiar with iTop, great, pop it in the chat. I know there's a few of you on the call that have been to one, so I'm happy that you're here. But iTop stands for individually trained oral prophylaxis. That's the patient's prophylaxis, and it's individual because it shouldn't just be brush and floss, right? Everybody gets the same tools. And I love how many different tools that you all incorporate at Dove, right? You have so many different things in your toolbox that you're looking at every single patient and you're saliva testing and you're looking at the microscope. And I know Barb does this too, and a lot of you on the call may as well. And you're individualizing care for every single one of those patients. And that's what iTop is all about, is taking every single patient and making it very individualized and really going back to basics. So the concept of iTop and iTop for home care is that we really should be able to keep our teeth, right? These days we shouldn't just be like, well, we're getting old, so we just lose our teeth. That's the way it should be, right? If we have a highly qualified specialist, well, guess who that is? That's us, right? We're the prevention specialists who can actually teach the patient about effective, non-traumatic techniques and devices. So ITOP is all about finding tools that are acceptable. And Haley gave you a lot of really great ideas tonight, things that the patients will actually like and use, tools that are effective, and there's not one tool for everybody, right? We'll talk about different tools tonight. Haley did as well. It's the magic of finding what works for that patient, but also finding tools that are non-traumatic. And the sad part of being in the dental profession for a long time, some of you have been practicing 40 years, how many patients have you seen come in with recession and abrasion? And oftentimes it's because of their own oral home care products or the way they're using their products. And so how can we approach home care in a way that they'll do it, it works, and it's not actually causing any trauma? So that's what ITOP is all about. We believe that hygienists, especially, but dentists as well, should go back to basics. We should all master how to manage biofilm in our own mouths. And I'll be the first to admit that's not how we've taught. That's not how most schools teach. I'm curious how many of you spent time in school, whether it was dental hygiene school, with a toothbrush in clinic or in the classroom, and you actually practiced brushing in your own mouth. Because if you were one of my students, we didn't do that. We did it on each other. We did it on a dentiform. But how many of you actually did this, right, in your own mouth? And that's where ITOP came from, was a dental professor in Germany sent all of his dental students home and he said, okay, everyone read about the BAS technique and we're going to have you all come back next week and demonstrate how to brush. And they all came back and everybody brushed differently, right? There was 10 different versions of the same brushing technique. And so this concept of, can we really learn really effective home care from a textbook? Probably not, right? And so we've done all this CE, but how much of this is hands-on when it comes to home care? And that's really the difference that Switzerland's bringing over Keratin Academy and why 90 countries are doing it this way, right? Is getting all of us back to basics hands-on. And that's a really, really amazing change. And getting to do this with people, I get to see this every time. Everybody's like, wow, I didn't realize I was brushing like this or brushing like that. And we're dental professionals, right? So how much more do our patients need a little bit of help? So it's all about coaching. It's all about getting hands-on. It's all about this touch to teach idea. And so in the patient chair, Haley mentioned something I think was super important, and this is exactly what we recommend, is sitting your patients up and doing home care, not just with a dentiform. I want to encourage you to even take that dentiform and set it off to the side a little bit more, even though that's probably how I taught most of you. But to get the toothbrush in the patient's mouth and have them brush, have them show you, you watch, you observe, you do what's called touch to teach. This is the ITOP philosophy, and you actually can adjust that technique right in their mouth while they are learning home care. And the research tells us that patients learn really well this way, right? This touch to teach process of I'm actually teaching you in your mouth, not over here on a dentiform and you're watching me and you're like, okay, 45 degrees, got it, wrap it like a C, sure. I'm gonna go home and try to mimic that as much as I can. So that's the first thing I want to encourage you with this ITOP philosophy is if you can, have the patients open up their home care aids right there. I would discourage, and if I could, go back and teach y'all differently for those of you that I taught, never, ever, ever hand a patient a goodie bag. And we shouldn't even call them those that, like call them something else, right? Your preventive tools with them all still closed. They should be open, they should be used, they should be experimented with in the patient's mouth, right? And that's a very, very different approach than the way that most of us were taught in school and the way that a lot of us practice. And so I'm, curious if anybody's already doing that. I love that, at WIS, you do a lot of this already. You're already sitting the patient up and getting in their mouths. So I'm going to just walk you through a very teeny little mini ITOP workshop. ITOP is a 6-hour certification. We have actually a lot of you are from Washington. We actually have one coming up in Spokane, May 2nd, one in Seattle, May 30th, and then we'll be doing some more throughout the year, one at ADHA in the fall. But I want to walk you through a very mini interactive experience. Now, when I do this with schools, I love to send the products ahead of time if they're all in the classroom. And now students are learning it differently. They're all sitting in the classroom and we're brushing together. We're using different tools in our own mouths. And schools across the country, including Harvard, including all kinds of great schools, are learning how to do this differently. So tonight we're going to do this just in a very mini quick way. We don't have samples in front of you yet, but I do have a surprise for you at the end. We might be able to get you some samples afterwards, but you will be the first audience that we are able to do this for. So I hadn't even told the Social 630 yet. We can thank our CEO, Thomas, for that. I've been begging him to set this up for me. So you won't have them with you tonight. So I'm going to teach you how to kind of use them. And then when they arrive, you can do this along with the recording. I think you can actually go back and watch it if you want to, but I'll just show you where all these videos are on YouTube. So To start, we always start with this big question, right? What is the general message to the public in the United States? It's been this way for a very long time. Brush, floss, rinse. Now, Haley talked about different rinses, right? And what kind of rinses are we using? The philosophy when I first started teaching disease prevention was exactly this. It was brush with whatever toothbrush the patient will use. It was everybody flosses, and it was kill everything with rinse, right? Do y'all remember that? I mean, it hasn't been that long since that's changed, at least for the general public, but this is still the recommendation, brush, floss, rinse. So the question is this evidence-based? What do you think? What are you reading in the research and the science? Are patients doing it? Is it effective? And is there something better? So I don't know how many of you have seen this study. This is one of my favorite studies. This was done for the Academy of Periodontology. They surveyed thousands of Americans and they asked them this would you rather game. My kids love this game. So would you rather floss or clean a toilet? Would you rather, you wondered why I had a toilet on my screen, I'm sure. Would you rather floss or sit in gridlock traffic? And what do you think people said? If you haven't seen this study, right? So over a third of Americans said, I would definitely rather do anything other than floss. I'm like, who would rather clean a toilet than floss? Floss is not that bad, right? And a third admitted that they lied to us, which I would say most of us kind of know that already. You have the patient sitting there chair and like, oh yeah, I've totally been flossing since I saw you last, and they're just gushing with blood. Now, I'll say maybe some of them actually are, and it's just not what they need for their mouth, right? But a lot of times they are actually maybe lying to us. So it's very interesting when we look at floss and we think about those criteria. Is this an acceptable tool for patients? There are a lot of patients that are telling us, I'm here for my flossing lecture, right? And that's the reputation that we've gotten. And that's a sad reputation to have, right? So when we look at floss, this is the question that I'm asking America, to everybody that I can possibly talk to. Is floss boss? I got this question from Dr. Joanne Granulin. She's the head of education for ADHA. I asked her where she got this, is Floss Boss? And she's like, I don't know. So we don't know who to give it credit to. So I just give her credit. But is Floss Boss? And it's interesting when you look at the studies, and I have a slide at the end. If you're a research nerd like me, I can't even count the number of studies I have in there now. I have a QR, you can scan it. I have probably almost 100 studies now that I've accumulated on all the things. So you're welcome to have that. But when you look at the science on floss, and I'm talking about high level, you remember the research pyramid, right? What were the very top of the pyramid? Meta-analysis, systematic reviews, Cochrane reviews, right? Where we're looking at tons and tons and tons of studies. Floss has very little benefit beyond brushing in the science. The first time I heard that, I about fell off my chair and I rethought my whole entire career. It's like, are we serious? When you look at the Cochrane reviews, evidence is very low. No meaningful clinical improvement with floss. Meta-analysis, randomized control trials, results of floss are inconsistent and reliable. Floss produces a small reduction in bleeding. And again, poor technique. We're going to talk about compliance, right? They'd rather clean a toilet. So in general, minimal effects on plaque and gingival indices in perio patients, especially with floss. So I'm going to give you a second to take a breath. Because the first time I heard that, if it's the first time you're hearing it, I was like, this can't be true, right? These must be brand new studies. Well, when you look at my research references at the end, if you can, I know they're small because there's so many, I had to shove them down on the bottom of the slide. Some of these are not brand new. They've been around for a little while. So we have known for a little while that maybe floss isn't the gold standard. And if you have graduated recently, actually the textbooks are starting to update this, which I'm so proud of because textbooks are often very behind. As an educator, I'm like, okay, this is not current anymore, but they're starting to add some of this into the textbooks. But floss is not necessarily the gold standard, especially for all patients. And that's what the science is telling us, right? So let's take a look at the anatomy. Pop quiz, okay? For those of you that had me as a teacher, I'm back. So where does periodontal disease start? What is this area called? I just gave it away. Okay, it's called the caul area, right? So when you take that patient that, let's say they're like, I actually really like flossing, and some patients do, right? It's not everybody, but they're flossing really well. They're wrapping it like a C shape. They are really doing an excellent job flossing. This is what is happening with that floss. Floss is a flat string, right? The caul area is curved. So even in your flossers that are doing an excellent job, we are still missing biofilm down in that area. And of course, we know as hygienists, dental professionals, dentists, that this is where the disease is starting. This is where our problem areas are, especially interproximal. And then when you think about interproximal, right, how are teeth shaped? Remember dental anatomy? I did never taught dental anatomy, never wanted me for dental anatomy, but concavities, right? So we know that teeth are not boxes. So if we take that same flat string and we do that same experiment, even with my really good flossers, we're still missing something. So they're doing their very, very best, right? Those small percentage of people are actually flossing, but we're just not quite getting it in some of these patients, especially our patients with more disease. So the first time I heard this, I was like, wait a minute, wait a minute, wait a minute. What about decay? Okay, because I always learned, and I probably taught a lot of people in this call, you have to snap that floss right through the contact, right, to prevent decay. So that's why no matter what we're using, we still need floss. Well, interestingly enough, again, when you go back to the research, and these are again high-level Cochrane meta-analysis, systematic reviews, evidence for flossing and caries prevention is limited and inconsistent. And when I heard this again, I was like, what have I done with my whole career? This is crazy. Caries reduction benefits were mainly observed when people were flossed professionally. So I don't know about you, but how many patients stop by on the way to work and they're like, I'm here for my daily flossing, and you do their thing and then they go to work, right? It doesn't happen. So why is this the case? Why does floss not even really helping us much with caries? Well, here's what's interesting and something that I learned in Switzerland, and I was almost embarrassed to admit I never understood this, but thankfully the rest of the faculty that have had this training said the same thing, so I wasn't alone. But does decay actually start at the contact? That's the question with decay. If you take a look at these teeth, here's your red circle is the contact. When teeth are in contact and you're eating, chewing, biting, the contact is actually self-cleansing. So decay does not start at the contact, decay starts below the contact. So even radiographically, when you take a look at where the teeth are touching, that decay is starting underneath the contact. So when we think about it, we've got these two areas, right? If I've got to choose one tool, for example, which area is more critical to clean? Our top circle, little circle, or a big circle? What do you think? Okay, if we can get a tool, this is the magic, if you can find the right tool that will actually fill that space, get down into the sulcus, up underneath the contact, we can actually prevent periodontal disease and caries if we can find the right tool. And that's the most challenging part, right? Now, I want to clarify that I am not anti-floss, okay? I am not like, don't ever floss, don't ever recommend floss. There's a lot of people that floss, never tell a patient to stop flossing, right? Of course not. There's still a lot of patients that even despite the smallest interdental, which we'll talk about different sizes, floss may still be very needed for that person, right? There's definitely times. But I want to encourage you, if you are teaching floss, we all assume patients kind of sort of know how to floss, or we might just tell them, make sure you're wrapping it around like a C, right? How many of you have seen this in practice, these floss cuts? We know that floss
พิมพ์มาให้
can
พี่ดูก่อนนะเอาพิมพ์ให้
yeah. So we know that floss can actually be traumatic, right? Floss is not necessarily an atraumatic tool. We know that oftentimes patients take floss and they just snap it around, right? Especially if they're just trying to quickly go around their mouth. They're like, I've got steak in my teeth, right? It's a quick process. So when we're teaching floss, we really want to make sure we're all about technique, right? And showing the patient, again, ideally in their mouth. I know that takes time, but more than a dentiform. And I mean, a lot of you do this maybe as you're flossing the patient, right? Grab a mirror, let me show you how I floss. I love that approach, right? We have to optimize our time as much as possible. But when we're doing floss, we want to make sure we're focusing on technique. But what about interdental brushes? So again, so many studies, I can't even fit them on my slide. But when you look at the research studies, high level studies, right? So meta-analysis, Cochrane reviews, systematic reviews, network meta-analysis, interdental brushes outperform floss. For plaque, for gingivitis, there's a lot more compliance. There was a brand new study, 2025, that looked at all kinds of tools, and everything with one hand ranked higher than floss. Can you guess why that might be? I'm imagining there's a lot of people out there that are doing their one-handed home care, right, while they're on their phone. I will admit that's sometimes me as well, okay? So one-handed tools, much higher compliance, right? So interdental brushes would fit into that category. Interdental brushes yield the best reduction in gingival index, especially with patients, so less inflammation. Significant improvements in all of our high-level studies. So in general, clinical evidence actually supports interdental brushes superior to floss. Now let's go back to the anatomy, okay? We already looked at this once. Let's take a look. If we have the right brush, right? And there's a lot of brushes out there. I'm going to talk to you about some different examples. If we have the brush that actually fits the patient's space, this is what we can see. This is the magic behind interdental brushes and why I think the science makes sense. If you are actually taking a brush that fills the space, you will actually reach into the caul area, into those concavities, right? So we actually do see better biofilm management when we have the right tool. And floss is not always that tool for patients. So what's interesting, I love working for a European country because I feel like Europe's always just a little bit ahead of the US on a lot of things. So the European Federation of Periodontology now recommends, this is their official statement, flossing is not suggested as the first choice for interdental cleaning, especially in your periodontal maintenance patients. Interdental brushes are the first choice from the European Federation of Periodontology. So that's an interesting shift from the United States, right? Where we're like brush, floss, rinse, brush, floss, rinse. So it's really interesting. I'm waiting for the US to catch up. I actually had a conversation with ADA. They asked if we wanted the ADA seal, and I said, no, we have a Swiss seal. By the way, let's talk about the ADA recommendations for blush. That was last year in Chicago Midwinter, and I'm sadly having a lot of FOMO because that's where everybody is right now, and I'm not. But I'm trying to make a change, right? Like, why not? Why not go to the top and say, what are we doing in the US? We have to make a change because this is not necessarily the gold standard. So if you haven't already done this, it's time to rethink interdental cleaning. What are all the different tools that we recommend and how do they actually fit into the patient spaces? When you look at the anatomy of the tooth, there's so many things on the market, right? How are those fitting in the patient spaces? How effective are they? Is the patient getting healthier? Are they using them, right? So when we think about interdental brushes, right, there's so many in the market. And this is the danger behind saying to the patient, okay, I know you hate flossing. Let's try something different. I want you to go out and I want you to buy a Proxy brush, right? And the patient goes to the grocery store and what do they see, right? They're like, okay, my hygienist told me to buy a Proxy brush and there's 1,000 Proxy brushes. Well, the important thing to know is they're not all created equal, right? There's something that's called the new generation of interdental brushes. So going back to this slide, some of us use these with braces, right? Orthodontics, and it's like very kind of thick wire, maybe a little bit abrasive. Maybe we got a little gun shy on recommendations. When you look at the science actually, and you look at how many people recommend interdental brushes, dental professionals tend to only recommend Proxy brushes or interdental brushes for patients with large embrasures. So typically they've actually studied this by age group, typically in senior patients. They typically don't recommend interdental brushes for younger patients. And I hope that by the time we're done tonight, you'll change your mind on that. But what you want to look for is the new generation of interdental brushes. So the old generation of brushes, very thick wire. Okay, so think tissue trauma. Some of us saw it, and that might be why we were like, oh, I don't know about brushes. And then short, a little bit more abrasive bristles. So I have had a lot of dental professionals ask me, what about papilla flattening? If you're recommending interdental brushes, aren't you concerned about papilla flattening? And that is a very valid concern if you're using an old generation of brush. If you're using a new generation of brush, the really important piece to look for is a very thin wire and long flexible bristles. Okay, that's what you're going to see the difference in the old generation of brushes versus the new generation. So a thin wire actually allows you to access small spaces without tissue trauma. And then long brushes actually help you fill that space, right? Again, without tissue trauma, but being more like thorough in the cleaning, right? As you get into that interdental space, you're actually able to get all of that out. So there's a lot of different ones on the market. I wouldn't say a lot. There's a few different ones on the market with the new generation. Because we're sponsored by Curaprox, I'm going to show you our version, right, and tell you about ours. But we're not the only one, right? So a new generation is the most important. So the Curaprox brushes, I'll teach you a little bit about those because that's what I'm an expert in, right? I've tried all the other ones. The thing that I like about these, and the reason that I actually was using these before I started working for the company, which is also a funny story, is that the wire is very, very thin. It's surgical nickel free. And the bristles are the longest and softest that you can find. So everything that Curaprox makes, and I know that Haley brought this up to you, is very gentle. And that's the whole mission, right? Make sure that it's not traumatic, it's effective, it works, it doesn't cause any damage. So looking for a brush that has this thin wire, long bristles. And this is the difference that you're going to see. When you get a traditional brush that has shorter bristles, we're not going to get down into that sulcus. We're not going to get up underneath the contact. So what we need is brush with long enough bristles to be able to reach both of those spaces. So these, for example, have what's called the umbrella effect. So they go into a tight space, those long bristles open up, clean all that biofilm or disrupt all that biofilm, and they come back out. So they can fit into small spaces, be effective in that space, and then not have to scrub, go in and out a bunch of times, right? So what's very cool is there's a brand new 2025 study that just came out, and there's actually two studies now on the difference with calibrated interdental brushes. So again, we're one of a few on the market, but the science in general on calibrated interdental brushes is really exciting. Calibrated brushes, meaning individual brushes for different sizes, right? It's not one size fits all, demonstrated significant improvement over non-individualized approaches. So just telling the patient, like, go out and grab, whatever brand of little proxy brush or dental brush is very different than having them actually take a calibrated set of brushes. Now, what's the hardest part about calibrated brushes for those of you that have tried these, right? Guessing on size, right? That's at least that was my experience, right? So I was like, okay, let's try purple. Nope, that doesn't work. Let's try blue. Throw that one away. Let's try red. That's not the right size, right? Or the patient's at home guessing and they really don't know. So the really, really cool thing, the one thing that I really love about these is we have this very fun probe called the interdental access probe. So it's a colorful probe that actually goes in, measures the space, tells you exactly what color brush the patient needs. This is really unique. It's really fun. We do this in iTop. We measure all of our own spaces and we get to try on all the brushes and kind of figure out what size we have, which is really, really fun. The cool thing about these is once you figure out the patient's size, right, you can actually recommend these brushes for primary prevention, not just for perio patients with larger spaces, but primary prevention. So I know these numbers are a little small on the screen for you all, but this blue, the smallest, when you get your fun little rainbow sample pack, which I'm excited, I just can't get over how excited I am about that. The smallest one has accessibility of 0.6 millimeters, this top number. So it only needs a 0.6 millimeter space to get in, which is barely bigger than floss. Now the bristles themselves, that second number down here, will spread out to 2 millimeters, okay? So tight spaces, that means primary prevention. That means my children, if you've ever seen my kids' selfies with their brushes in, right? My children can use these in some of their areas instead of flossing, which I think is great because flossing my kids is really tough. Now, all the way up to the biggest size, when you get this prime set, this is your primary prevention set here, the green needs about 1 millimeter of space to go in, and it can spread out to 5 millimeters. That's just the primary prevention set. Perio set, this one, this blue one at the end, can actually spread all the way out to 10 millimeters. So when you think about how big of a space we can actually access with these brushes, the really cool thing about this new calibrated brush that's kind of happening across the world is we can use it for all different types of patients, not just the patients with these large embrasure spaces. So that's to me one of my favorite parts. And the other thing I really love is environmentally friendly. So ones I've used over the years too, lots and lots of waste. Like we talked about having to try different sizes, or after the brush wears out, you throw the whole handle away, right? The fun thing about these, this is why they're my favorite and they always have been, is they're sustainable. So when your brush actually starts to wear out, which is about 2 to 3 weeks. So think of it like a toothbrush. You use it, you rinse it off like your toothbrush. We brush facial, we brush, lingual. Why don't we brush mesial distal, right? So we brush our interproximal spaces, we rinse it off just like we do our toothbrush, and about 2 to 3 weeks later, the bristles might start to look a little bit worn. It's ready to change it out. And all you do is just pop the head off, you keep the handle, and you can see in this video, you just reuse the handle every single time. So lots of really cool things when you're looking at different kinds, different companies, and kind of comparing what you like about different ones. If sustainability is something that's important to you, like it is for me, this is something that I think is very cool. The office packs come refillable too, right? So let's look at a case study. I love this case study. This is a 21-year-old patient. So when you take a look at those pictures, do you start freaking out? Like, oh my gosh, we have so much disease. Like, there's just so much going on. I mean, I didn't the first time I saw him. I was like, yeah, you can see some rolled margins. There's a few things going on, but nothing too crazy, right? So what's interesting about these case studies and why I say Bob here, right? Most patients, we measure bleeding with what? BOP, bleeding on probing. So we probe the patient and then we tell them, here's your bleeding points. Well, how many of you have ever had a patient say, well, of course I'm bleeding. It's because you poked me. Okay. I'm sure I'm not the only one that's had that patient, right? So anybody ever heard of Bob that hasn't been to ITOP? Okay. Bob is bleeding on brushing. Now, the coolest thing about bleeding on brushing is you can tell a patient, okay, here's what your mouth looks like right now. We're going to go ahead and use a brush, right? And we're just going to have you, the patient, brush in between your teeth, okay? And let's see what it looks like. So this is the patient, okay? Bleeding on brushing. So this patient actually does have some things going on, right? And the patient gets to see that, okay, well, I'm bleeding, not necessarily because you poked me, because I'm brushing my interdental spaces or right in between my teeth. So what I'm going to say to this patient now is I'm going to say, okay, I want you to try this. I want you to look in the mirror every time you use these brushes, if you're using them at nighttime or whatever time works for you, and I want you to monitor your own bleeding. And if you've ever read anything about habits, with my wellness business, I'm really big on habits. I've read all the habit books. Habits need a loop. So a patient needs some kind of reward often in order to keep a habit going. So if I tell a patient, okay, keep an eye on this in the mirror, you're going to see that when you start using brushes in between your teeth, your bleeding will stop. And now the patient, after just a week of using it, is like, whoa, I can actually see a difference. Now I'm in a habit loop because I've seen a difference in my own mouth. I don't have to wait 6 months for you to probe me again and tell me that I'm bleeding. And again, I'm like, it's because you poked me, right? So this Bob idea is very cool. They do this in Switzerland. This is part of the training. It's something I'd never heard of. And we have hygienists and dentists are using this across the US after they've been to the course, and they're reporting that patients are loving this. Like they're actually compliant, which is a big part of our issue in dental hygiene, right? It's how do we get our patients to be compliant, right? So when we look at these brushes, it's very, very simple to use them. When you get your sample pack at home, you can look up this video on YouTube if you've never tried it, and you can pull this video up on YouTube for your patients as well. But if you have a wide embrasure or an open embrasure, the brush just goes straight in and out. It's very, very simple to use, in and out. If it's a tight space, this video will show the patient how to, like to say, like give it a little wiggle to get it in. So this is how you use it. Very, very simple. I should say dental professional. I'm working on that with the marketing team, not dentist. A little wiggle to get in if you need it. And if the brush is the right size, it's going to fit all the way through. So it'll clean all the way from facial to lingual. Patient can interchange it. So if they do need a longer handle, they can extend the one that they have to make it a little bit longer too. Once in, once out if it's a small embrasure. If it's a larger space, it might need a couple more passes. And that's the magic, right? So the idea is trying to find the right size for the patient, right? Using the probe is ideal. So I'm going to teach you, if you know Amanda Hill, this was at one of our events, I'm going to teach you how to check that you have the right size. So if you get your sample pack, right? You don't have the probe, you just have the brushes and you want to experiment for yourself. This is how you do it. So I always say start with a blue. Blue is the smallest. And I always say try an anterior tooth, put it in and see if the brush sticks out straight like Amanda's. Do you see how the blue kind of droops on me, like rolls around a little bit? So if I try to use this blue, it's not big enough for my space. So if I just tell a patient, go out and grab a little interdental brush and I just go around my mouth, I am not cleaning that entire space. I'm not getting down to the sulcus. I'm not getting underneath the contact. So if I put it in, let it go, I don't think that's the right size. If I try yellow and I put that in and let it go, what do you think? Can you see the difference? So yellow is going to stick straight out like in Amanda's selfie, and blue is going to wiggle around. So you can try this at home when you get your sample. Put your brush in, let go. It should stick straight out. You should actually feel a slight resistance, just like you were brushing the interproximal spaces on your teeth. So that's your trick when you get them. Put it in, let it go, see if it sticks straight out. It's really, really fun to do this with a buddy and take some selfies and tag us. They're my favorite. So please do that. I love it. So you can try this at home. You can try this with your patients as well. If for some reason you don't have the probe or the patient's going to go out and buy them or whatever that is, you can have them kind of test this too. Like if you let go of the brush, it should stick straight out. That's how you know it's the right size. So there's a lot of different techniques that are a little bit more advanced that we'll do an iTop to help the patients use these different sizes. But that's really the magic of these interdental calibrator brushes. Again, we're not the only company, but a few differences between ours. And the main point is that you can actually measure and check the size. So if you have questions on interdentals, pop them in the chat. I'm going to move on to toothbrushing. So another pop quiz for everybody. What is more important when it comes to toothbrushing? Tool or technique? And you can pop in the chat if you want to. I'm going to show you just a couple videos. So here is how your patients are learning how to brush on TikTok right now. Okay, what do you think? So good technique, right? I mean, it's so funny because I feel like There's so many times I'm like, of course my patients know how to brush, right? They've been in here for 20 years and somebody's taught them along the way, or I'm sure I've showed them along the way, right? And then you watch, just watch videos, go Google videos of patients brushing, especially on, I don't do TikTok a lot, but I get on there for fun things like this. And I'm like, oh my gosh, people are teaching people how to brush like this. Okay? And then take a look at this one. This is another fun one, I think.
Brushes at the same time. And we brush our teeth the same amount of times a day. But let me show you the difference between my toothbrush and his. This is my toothbrush, you know, nothing special. A little bit of bend in the bristles. This is my husband's toothbrush. What does he
We cut it off because I think she might, no, she doesn't say a bad word. It's fine. I'm not going to say bad words because we're recording. So tool, technique. Okay. Both are important, right? But that second video is to show you that you can have a really great tool and still completely destroy it, right? So we have to make sure that we have both. But technique is incredibly important, right? So I'm going to start with tool and then we're going to come back to technique. So tool, I'm curious in the chat, how many of you have tried the Curaprux toothbrush? So something that is very fascinating to know about toothbrushes in the United States. Most toothbrushes are made with nylon bristles. What nylon does is nylon absorbs water, which actually makes it harder, makes it stiffer, causes recession, causes abrasion, and also harbors bacteria. Now, typical toothbrushes, again, this is like a dollar store toothbrush, has about 500 bristles, right? So when you look at the different toothbrush designs, right, what actually really matters with toothbrushes? So I'm going to actually back up to right here. So when we've done some experiments with different toothbrush designs, right, we have so many cool designs in the US. We have bristles going every which direction. We've put rubber in them. We've put all kinds of crazy things in toothbrushes, right? But when you do these fun experiments, I try this at home. It's really interesting. My dental hygienist and I actually tried this experiment in my own mouth with two different toothbrushes to kind of see. And I wish we should do it again with disclosing. But disclose the patient and try different things. It's really interesting when you look at all these really fancy, crazy looking toothbrushes that because of the spacing in the bristles, remember that microscopic picture with the bristles? We are missing the biofilm, right? We're missing a lot of it because we don't have enough bristles or the bristles are not compact densely enough for a typical toothbrush. So what I want to encourage you to do is look for toothbrushes that are made differently, right? So the filaments are really important. I'm going to talk about that. When you do get your sample, the first thing I want you to do is just feel it and just feel how different it feels than every other toothbrush. Funny story on this toothbrush. I found my first Curaprox brush in 2018. So I was at the International Symposium of Dental Hygiene. I had never heard of this company. I saw this beautiful, colorful booth and was like, "Ooh, that looks fun. Let's go see what they have." Okay. I got my first toothbrush. I fell in love with this toothbrush. Okay. I have a lot of recession myself. I kept using this toothbrush. This is an embarrassing story. I know we're recording, but I'm going to just share it anyways. Okay. So for 2 years till the next International Symposium, I used this toothbrush in the morning and I used my electric at night. And this toothbrush still looks brand new. I know that's really bad, right? Still looks brand new by the time I went back because I was like, I can't get another toothbrush like this. I got to go back to the International Symposium. So then I went to Australia and I ran straight to the booth and I was like, I need a new toothbrush. I got mine in Ireland. I need a new one. I wish I could remember who was working the booth because now I probably know them. They were like, "You've had the same toothbrush for 2 years." And I was like, yes, I know that's bad. I am a dental hygienist, but the toothbrush still looked exactly the same. Crazy, right? The way the bristles are made in our toothbrushes in the United States, they wear out very, very fast. This toothbrush was the first toothbrush that did not contribute to further recession for me, that did not hurt my gums. I have a connective tissue disorder. Everything is sensitive. I'm also a redhead, which is apparently a thing. My husband calls it the redhead's disease, right? So finding a brush that's really, really gentle changed my world. And it's been that way. Like I said, 2018, I had no idea then that this would eventually be my job, right? It's kind of funny how life works serendipitously, I think. So when you look at your toothbrushes, the first thing I want you to do is when you get your sample, I want you to hold up your toothbrush that you've been using up to the light, and I want you to see how much light is passing through. Think about that as your biofilm. And then hold up this toothbrush and see how much light is passing through. And it will be 0 because the density of the brush head, it's not going to let light pass through. It's not going to let as much biofilm pass through, right? It's not a perfect science because we still need technique, right? But the density of your brush head does matter. So when you think about these different brush heads, right? Do you have a toothbrush head where the handle or the angle of the toothbrush is actually bendable or it's already even angled? So looking for toothbrushes that have a slight angle is going to help the patient access the posterior areas, okay? Also, very rare to find a toothbrush that actually has an octagon handle. And what that does when you see that on a toothbrush is it actually allows the patient especially if they have any kind of arthritis, anything in their hands, allows the patient to hold and grip the toothbrush at the appropriate angle without creating as much pain, without slipping or rolling. But the most important thing, and the reason that I fell in love with it, and this is my experience, I was like, oh my goodness, it's a therapeutic mattress, is the Kieran filaments, right? So I talked about filaments in the US. Kieran filaments are a proprietary blend. It's more of a polyester blend. They are hydrophobic. So going back to dental hygiene school, which I love that Haley did that. I was like, this is so fun, right? Going back, hydrophobic means, right? Doesn't like water, which is good. So you don't want a toothbrush that absorbs a bunch of water. You want a toothbrush that doesn't absorb water, doesn't like water. This is going to make sure it stays more stable when it's wet. It's not going to harbor as much bacteria. The filaments aren't going to splay as much. It's not going to wear out. Okay, my embarrassing story. I'm willing to tell it because it's true. The toothbrush stays strong, but it's gentle. And that's really, really hard to find in a toothbrush. If you really sit and feel different toothbrushes, it's hard to find a brush that's effective, that's strong, but is also gentle on your teeth and gums. A lot of our toothbrushes have sadly caused a lot of damage. The other thing that's hard to find as well in the US is a toothbrush that has rounded filaments, not flat or pointed filaments. So most of our filaments in the United States are very pointed. So again, if you take that and you take it on top of, especially cementum, if you have any recession, now we're creating a lot more problems. So finding something that's gentle, effective, and less abrasive is important. And I dug into the research because when I first started loving these, my dental hygienist, who has been my dental hygienist since I was a first year dental hygiene student, isn't that a funny story? So she has done my dental hygiene therapy for 20 some years now. She was like, well, wait, if it's too soft, it's probably not going to work, right? So I was like, well, let me dig into the science. So I went and looked at the research, right? Is there any studies that talk about gentle toothbrushes and can you still be effective even though the bristles are softer? And the answer is yes. There is research to support that gentle toothbrushes are just as effective without causing damage. So there are patients that just like the feeling of a more aggressive toothbrush, right? But we can get the same result or a better result even if we have gentle bristles. Now, this is a really neat study. 6 months of simulated brushing. This is the Kieran filament versus the typical nylon filament. First of all, just look at kind of the spacing in your traditional toothbrush versus the more densely compacted head. 6 months of simulated brushing, 72% less abrasivity. So in my mouth, this has made a difference since 2018, and that's why I love talking about it. So now let's go back to technique. I love the tool. You're going to get one. You're going to love it. You're going to fall in love. I know it. You're going to have to message me and tell me that you love it. Toothbrush technique, of course, is important. We take a look at the science, right? And we know, I don't know where my references went on that slide, but we know that most patients don't know how to brush. And that's evidence-based, right? We know that most patients either don't brush long enough, average in most studies is about 29 seconds, or they're not brushing properly, right? So if we don't teach them how to brush, right, they're going to do it their own way. They are going to have all kinds of techniques. I love kind of watching the married couple, like, brush their teeth. They all have a different dance. Right? So taking a moment and actually teaching our patients brushing, even if we're busy, even if we don't have a lot of time. So this is what we do in ITOP. We spend a lot of time brushing our own teeth. This was the very first ITOP we held in the United States. You can see Lancette Van Gelder, our ADHA president there. She is now our certified lecturer. So she actually is the keynote at our courses. So if you come, she's phenomenal. And we all signed up, including me, having no idea what we were getting into. And I invited some friends and I said, come with me. And they were like, we're going to brush our teeth for 6 hours. And I said, I think so, but I think it'll be fun. Okay. And so thankfully we all came and it was incredible. It was incredible to get to practice this experience. And so what I want you to do when you get your toothbrush is I want you to follow along with what I'm going to do here in a second. When I do this with schools, we do it together because they usually will have their toothbrushes. But what I want you to do is just start brushing your teeth, right? Without playing this YouTube video, I'm going to have you look at this on YouTube when you get your brush, but just brush your teeth the way you normally do. And I have your patients do this too. The first thing that you want to do is just kind of look in the mirror, watch how you're brushing. And with your patients, same thing. Just show me how you brush normally, right? Now I'm going to start this video. I'm going to stop it a couple times and just give you a couple of the little iTop tips for brushing. So here's the first one. Okay, there we go. So I love experimenting when you're brushing with me because I like to stop it. And a lot of people are like, oh my gosh, how am I holding my toothbrush? So I had to go all the way to Switzerland to realize I was holding my toothbrush like a weapon. Now I'm giving it away. So some of you will get your toothbrush and not do this, but just try to brush the way you normally do. And I'll tell you, it's kind of a bad habit. No wonder I have so much recession, right? So I was just brushing along, rushing along. And I had no idea, y'all. I taught disease prevention for years. So again, I am telling you all my embarrassing stories because this is not about a lecture. This is about being humble and recognizing that we can all be better, right? So the first thing to look at in our patients and ourselves is how we're even holding the toothbrush. We have a lot of recession damage because of our toothbrushes. So holding it like a pen, some people like to say, like a flute, right? But a light grasp. So telling that patient, try to just hold it like a pen, right? Is the first thing. Now, the second thing we do, have your patient put the toothbrush half on your gums, half on their teeth, tilt it up towards their gums, forget the 45-degree angle, right? And just have them start doing some circles and have them close their eyes. Okay. And I love doing this in a classroom because everybody is like, really? You're going to make me close my eyes? Yes, I'm going to make you close your eyes. So when you get your brush, I want you to do this. And what that does for the patient, if we think about learning styles, right, and different sensory needs, if we turn off other senses and all the patient is doing is feeling the feel of the toothbrush in the sulcus, we can finally help the patient understand what it feels like to actually brush along the gum line, to use the correct brushing method instead of just telling them like angle it at the gums 45 degrees, point it this way, point it that way. And sometimes the patients are like this way, that way, up, down. So having them do half on the gums, half on the teeth, point it up towards your gums. Now close your eyes and try some small circles. And I say to the patient, do you feel that actually brushing along your gum line? That's where all that bacteria, infection, right? All the words you want to use to make it scary. Don't just say just a little bit of bleeding, right? This is where the infection is, right? This is where we need to be focusing our brushing. And it's really interesting how many people come to iTop, dental professionals that have been brushing their teeth for 5, 10, 20, 40, 50, 60, 70 years, okay? And they're like, wow, this is a really different experience. So there's a lot of different tricks and tools and different ways that we can adjust, ways we can reach the bacteria, that's a new word, I just made that up, the posterior teeth, different areas of the mouth, right? And so in iTop, we spend a lot of time trying to individualize brushing to every patient as well, because there's, it's not a one size fits all. It's not a one technique fits all as well. But if nothing else, whatever toothbrush the patient uses, right? I mean, yes, I love our toothbrush, but the idea of iTop is how do we do home care? Have the patient brush, watch how they're holding it, have them close their eyes if they'll play along with you and feel the bristles. And that alone will create a totally different home care experience, no matter what toothbrush you're using, right? So to bring these worlds together, right? Are we really individualizing home care tools and techniques, right? So we talked about interdentals as an alternative to floss. We talked about what kind of toothbrush you're using. Now there's a lot of different other individual tools out there. I'm not going to talk about all of them, but if you do have a patient that has extreme sensitivity or recession, like me, this toothbrush I found later on down the road is called the Velvet. So the one that you're going to get has 5,460 bristles. So remember I told you dollar store toothbrush, about 500 bristles. This one, 5,000 bristles. So 10 times the number of bristles. Now a Velvet has even more bristles. We're talking 12,000 bristles. So literally like the softest toothbrush on the planet. So this is for your patient like me, thin periobiotype, recession, high risk of cervical abrasion, especially if they are brushing hard, right? Especially if they're holding their toothbrush like a weapon. Think about offering them or recommending that they try something even more gentle, which I know is kind of hard to believe if you've tried the traditional one. There's also wooden if you like sustainability. The cool thing about the wooden, if you are a holistic provider, is this is Swiss beechwood. So bamboo, great. I've always recommended bamboo toothbrushes, right? You have to cut the bristles off no matter what because the bristles do not recycle. But bamboo gets mushy and moldy. Swiss beechwood does not. It actually holds up really, really nicely. And this is easy to just actually kind of tear and cut those bristles off when it's time to recycle. But what about single brushing? So do y'all remember the end tuft brush? I'm curious how many people are using the end tuft brush. This is a brush that has been around for a long time, right? The old end tuft brush version. The thing I liked about the end tuft brush is it was great for patients to get into areas that were hard to reach. The hard part about the end tuft brush was the abrasivity of the bristles, right? Just like a lot of our brushes. So when you look at the studies, randomized control trials will tell you that a single tufted brush works far better than a traditional brush. However, could you imagine telling your patient, okay, I'm going to take away your toothbrush and I want you to use this single brush all around your teeth, right? When we think about those pillars, are we going to have acceptability or compliance, right? Not in a lot of patients. But for this patient, this is my favorite use for a single brush, whether it's this one or an end tuft brush. when you have these overlapping lower anteriors and you are spending forever scaling in that area, think about remembering these single brushes, right? Getting these into those areas, implants, braces, rotated teeth, all these different spots, kind of thinking about what else we can offer to the patient without overwhelming them, right? But it's really fun. The single brush technique has been around from the beginning. It's how we brushed in the very, very first, ever records of brushing. It was a single stick. If you are on Survivor, we are watching Survivor now, this is still how you brush your teeth, with a wooden stick, right? But we like to call this, we just named this actually at the last iTop. I can't remember who coined it, but this isn't the Netflix brush. So if you do have a patient that likes to do the Netflix and chill, this is really good for stain as well, using a single brush. So thinking outside the box, right, with the different brushes, a single brush is really, really effective, especially in a patient that has specific areas that come back every single time with a lot of plaque and tartar. All right, let's talk electric toothbrushes here. So we usually have two teams, right? We have a couple different toothbrushes that have been on the market for a very long time, and we usually are one team or the other, right? Well, when I first met this toothbrush, I was like, oh, please try to convince me to get rid of my electric toothbrush. I've been a fan my whole entire life, right? Well, what I like to say about the hydrosonic toothbrush, and this is not official marketing, I just made this up, but if our two biggest competitors got married and had a little toothbrush baby, this would be the baby. So what they did in Switzerland was they took all the technology that exists, all of the science around different styles of toothbrushes, and they took all the best of both worlds and they made the hydrosonic toothbrush. So this is the next gen level of electric toothbrushing. So you'll see the small brush head. It's a diamond or more of a teardrop shape, and you'll kind of see in the video why that's the case and why it gets to the linings a little bit better. You'll notice that it also has the Kirin filaments. This is the most important part of this toothbrush. So if I go back to my history with my electric toothbrush and my death grip, and maybe I'm a patient that's not even using the right technique, right? Maybe I'm scrubbing instead of actually using proper technique. I'm potentially doing quite a bit of damage potentially with my electric toothbrush, right? So hydrosonic is definitely there to make a little bit of a difference. So the other toothbrush that I think, yes, we have kind of the two biggest ones, but anybody around long enough to remember the Rotodent toothbrush? I was a dental assistant in the 90s and we recommended the Rotodent toothbrush. Some of you remember it. Good, I'm not the only one. I know, Barbie, you remember the Rotodent. So this toothbrush was so cool, right? And they stopped making it. So what's fun again, Swiss genius decided, hey, well, let's throw the Rotodent in here too. So now we have three cool technologies that are all built into one toothbrush. So the hydrosonic, if you get the Hydrosonic Pro, comes with a single brush. So that single brush I just talked about, put that on your electric toothbrush. Now you have your own little home, prophy, I say, for us as professionals. But for patients, I'll show you a quick video. It gets into the coolest places. So this did become my favorite toothbrush, electric toothbrush. What I do is I use my manual in the morning and my electric at night. And that's what I recommend. I think you can get two different benefits out of both brushes. But the Hydrosonic Pro is really fun. Everything we do is colorful. So my favorite, this is the pink brush head. That's my favorite one. My daughter's too. So small brush head, sonic action, right? So we're using vibrations. We're using 44 to 84,000 minutes of movements a minute. We're also having that hydrodynamic effect. So we've got mechanical, manual biofilm, and hydrodynamic biofilm disruption. The three brush heads I already talked about. It still has the timer and everything. What I like about this brush though is it doesn't turn off at 2 minutes. Does anybody know where we got the 2 minutes from? If you look at a lot of recommendations every 6 months, 2 minutes, most of this stuff was made up. It came from a commercial at some point back in the day. It's not a lot of science behind this. So this 2 minutes is interesting because what the hydrosonic does is it'll make a big vibration at 2 minutes, but it keeps going. And I love that because a lot of brushes turn off and the patient's like, cool, I'm done. And I tell my patient, hey, it'll make that little vibration. It's been 2 minutes. Now go back to these, problem areas, right? So the patient will actually maybe brush a little bit longer. Go figure, which is kind of cool. So again, research and science on the technology, the brush head size, clinically effective, also gentle. So the Kirin filaments is really, really magical. So a couple quick videos. This is what we're giving away tonight here very, very shortly. So this is what the hydrosonic looks like. Nope, I didn't want to hold that video. Okay, so don't you all wish you had that when you had braces? I had braces twice, and I was like, where was this toothbrush when I had braces? Are you kidding me? So if you recommend any electric toothbrush, here's my suggestion based on everything I've learned and all the training I've had in Europe. The patient needs to bring it with them every time, no matter what toothbrush it is. And we need to go over technique with them. Now, if you're offering a toothbrush, ideally, have it right there in the office. Patient can open up the box and start using it, and you can teach them how to use it. All of our videos are on YouTube if this is the toothbrush that you're recommending, but technique is so important with electric toothbrushes. And I'm sure many of you have seen it. Again, damage we're doing to ourselves, our patients, with our own technique, especially when you take nylon bristles, you take hard bristles, you take too much speed, and then you take incorrect technique, right? So all those things combined. So this is a technique video again on YouTube, and this will kind of show you how to use the hydrosonic with the teardrop shape. So if you're recommending this, you can show your patient on YouTube. So notice that gentle rocking back and forth. So the patient's not scrubbing, they're just gently rocking distal, mesial, distal, mesial. And that teardrop shape is actually getting into the line angles, which is pretty magical. Since if you disclose in your office, like I know you do at Dove, right? What do you all see? Line angles and line angles of biofilm, right? All the time. So that little bit of a tilt rocking motion is really, really cool. And again, the patients can watch this over and over again to refresh and to review, right? There's a lot of other cool tools. If we do a brush and learn for your office, we will send you all the fun things and talk about them all. But just keeping in mind as dental professionals, there's so many tools out there. Like, did you even know there was a toothbrush that has a channel down the middle that goes around brackets for orthodontics? I didn't either until I met it. Did you know that there's an implant brush that's perfectly angled, right, to reach the lingual? There's surgical brushes. There's so many really cool things out there. And so when you think about your home care products, just like Haley talked about earlier, we have to kind of get a little creative. I think sometimes we get in a rut, right? Especially with the traditional brush, floss, rinse, right? The last thing I want to show you is very, very cool, and it's near and dear to my heart. Has anyone heard of the Samba? I have a special needs daughter, and my daughter uses this when I'm traveling. When I'm here, she still lays in my lap, and I brush her teeth every single night. She's 10 years old. We'll do it forever, probably. But when I'm gone, I come back to gingivitis every time. And my husband is horrible at brushing and flossing. Horrible. So my daughter uses the Samba. This has been what a lot of people call the game changer. So if you have a patient that really struggles with brushing, cannot brush independently, they have arthritis, they have dexterity issues, they have any kind of disability, learning needs, the Samba has been such a really beautiful gift for these patients. And let me show you how it works. It's not just another vibrating U-shaped toothbrush on TikTok, because there's a whole bunch of them out there, but it actually has bristles that are angled at the gum line. So it actually is going to brush the patient's teeth. They don't have to move it around. They just hold it still. The opposite bristles are going to clean the occlusal surface while the other side is cleaning along the gingival margin. So a really, really neat option for any patients that need that independence in brushing. So Samba is just something that I have to tell everybody about, even though it's not really part of ITOP, because it's such a cool gift if you have a patient that needs it. So to wrap up, revolutionizing oral self-care, right? Combining tools, techniques into behavior change. That's how we get biofilm management at home, right? There's a lot of different things we can do. So motivating our patients, Haley started talking about this, motivational interviewing. If you're not familiar with motivational interviewing, I published a couple articles on it with a friend, Heather Anderson, and it's such a cool concept. The basics is asking questions, right? This takes time. Instead of just telling the patient, we ask the patient questions. What are you using to clean between your teeth? Do you like to floss? Would you be open to trying something else? So it doesn't take a lot of difference, or practice, but it's just a matter of trying some different things. Using the touch to teach we talked about tonight. Thinking of yourself as a coach. We're not a tooth scraper. We're not an oral janitor. We are a coach. We're coaching our patients. And that's really our goal, right? Is we are coming alongside them as coaches. But we have to be able to educate the patients. We have to take our expertise, right, and pass it on to the patients. That is the goal, right? So I hope you want to join the ITOP movement. This is all of our 2025 community that we've created. I know there's some of you on the call that are in some of these pictures. It is such a fun movement. It's so cool to bring this training from Europe to you all. It's been such a joy of mine. It's completely changed my life and a lot of people's.
Awesome. Thank you so much, Sarah. That was amazing.
It was so fun.
So good. So good. And congratulations, Teresa, on winning the hydrosonic. You're gonna love it. It's what turned me into a electric toothbrush lover. You might have seen that in the chat. Kristen, she was teasing me on the chat because I didn't used to actually use a electric toothbrush because I don't know, the vibrations were just like overstimulating. I don't know if I have like a sensory issue that I
Yeah.
didn't really know I had. But game changer for me. Game changer for me.
I love it.
Yeah.
I love
So she's gonna love it.
That's
Gonna
awesome.
love it.
That's
All right,
great.
I'm gonna screen share just to end our CE here tonight. Let's go.
I put the link in the chat to get your free sample pack if you didn't have a chance to scan
Oh,
my QR code.
perfect.
So,
Thank you for that. All right, Q&A. If anybody, I tried to go through and Haley and I tried to answer any questions anybody had um, during the presentations. If you have anything that didn't get answered that I missed or that you were saving till the end here, feel free to unmute yourself. If anybody has any remaining questions.
now I have to go back and scroll through the chat. Sometimes I like to watch it. So I'm like, I'm curious to see what everybody's
I know
saying.
it's hard to do both, isn't it,
I
Sarah?
know.
It's so hard to
Sometimes
do
I
both.
do, but tonight I was like, I'll let you guys watch the chat, but it's so fun.
Oh, yeah. I love reading it, and
I
it's
know.
hard when you're doing both. It's really hard to
Sometimes I get off track because then I start chatting in the chat and then I'm like, oh, now we're over time. Y'all, if you know me, you know I like to talk. So, but
Yeah.
yes, please, any questions you have, happy to stay on and answer anything for myself or Haley.
And we, the Social 630 girls from Dove Dentistry are going to try to attend the ITOP in May in Seattle, right? Seattle area. I don't know if it's been officially announced yet, but
Not yet. May
Sarah.
30th. We're still looking for a location. I should have that secured very soon. So
Okay.
it'll be right after Pacific Northwest Dental Conference if you're attending. And the Spokane one is after the Inland Northwest Dental Conference in Spokane, May 2nd. So following both conferences.
Awesome. So great. We're very excited about that.
I'm excited to have you all.
All right. So I'm guessing there's no other question. Oh, was there one other one that I missed?
Mhm.
Did you see it, Sarah?
I don't see anything. I'm
My
scrolling through.
Oh, halting mouthwashes. I know I answered a couple questions about mouthwashes. I can review that again. Our philosophy at Dove, just based on like the literature and research that we have studied, we just try to kind of tell our patients to put a pause on mouthwashes. We focus on trying to build that good commensal bacteria. Haley focused a lot in her presentation on, disrupting bacteria, disrupting biofilm, and the negative, carriogenic pathogens and periodontal pathogens, but we really tried to help build up good bacteria in their mouth. And if and when, on the rare occasion that we do use antibiotics with periodontal therapy, we're very big on trying to build gut bacteria and oral bacteria, good bacteria, back into their mouth and doing a lot of nutritional counseling with them on their diet. So I know that there were some questions about that in the chat. Um, there are good mouthwashes on the market. I do want to make sure I say that as far as like products being clean and pH balanced and all of the considerations taken into effect in the development of those products. But a lot of the ones that your patients can get so easily at the drugstore have really active antiseptics in them. And so we try to steer away from those. Anything alcohol based, peroxide based, the like oxide agents, oxidizing agents, that sort of thing, just for long-term use. We like to use them for when you need them. We want to keep it for those times when they have surgery, when they have implants placed, those types of things. So that way, when you need those types of products, they actually work. So hopefully that answers some of those questions. Anything else that I missed?
I love seeing all the Samba fans in the chat. That's
Yes, that was so good. So good.
I did see a question about interdental brushes in children, and I will say that the blue is a little bit bigger than floss. So depending on the spaces in my kids, and I saw the question specifically about ADHD and autism. My daughter has both, and I will tell you the truth. When I come at her with this, she's like, "Go away, mom." But if you build trust and bribe with Barbies, then you can get these in there depending on the space. It doesn't fit everywhere. I would love to see even one size down someday, even. But I will say that for her, I also love in Spokane, we have the maker of the slate flosser. And, it's just, again, one-handed and it's easy to get in there and it vibrates and it's kind of like the flouse. They're very similar. So I'll use a little bit of interdentals and a little bit of that for her. So it does help, but some kids are still a little bit of afraid of it because it does look a little scary and pokey. So that's my experience with it. Any other questions? I don't see, I'm scrolling through. I don't know if we missed any.
We're good. We still have a best in chat giveaway
Yay.
to put on there. I ended the comment counting at the end of your presentation because congratulations, Teresa. That's what this slide was for. Whoever won. Um, but we do have a winner for the best in chat. So, oh, let me go back. I'm a little click happy tonight. Sorry. All right, Leanne Winkler. Leanne Winkler, are you
Ah,
on?
Leanne, congratulations.
Are you on, Leanne? Are you still on?
Yes, I
I
am.
think I saw her.
Congratulations. Oh my
Yay,
Thank
goodness.
you.
So we need to connect. I'm going to put our Gmail in the chat. If you'll just go ahead and just send me an email, send Christina an email at on, and we will connect with you and get address to ship that to you and get a size from you.
Thank you so much.
Yes, we're so glad that you got on, and thank you so much for participating in the chat and everybody else who did. There was some really heavy contenders in there. You guys were so active in the chat. I loved it. It was so good to see all the comments.
Leanne's a good one to win because Leanne has been on a lot of these with me. She has been such a faithful Curaprox fan. So if anyone to win the sweatshirt tonight, like Leanne, you can't see the Curaprox on the bottom, little interdental brushes. You're gonna love this. This is so cute. That's awesome.
Yes.
All right, I just threw that email in there, so hopefully you can snag that out of there and shoot me an email. That'd be great. All right, and then we just wanted to encourage anybody who's local to the Seattle area or South Puget Sound to register for our upcoming hands-on workshop. It's called Let's Get Basic. It is synergistic with this webinar that we did tonight. It's on nutrition, pH, and the beverage battle for oral health. We're going to dig deep into different types of chairside testing that you can utilize, when it's helpful, when it's not helpful, what we can do to better help educate our patients. So it should be really fun. We have snacks and food, and it's a good time. We had a blast last month, so really, really fun. We're loving these hands-on workshops. It's a really good opportunity to learn and grow together. And then coming up for our next webinar, we're excited to announce that Joy Lance will be joining us, sponsored by Guru Nanda. It's called You Need to Calm Down and Breathe Through Your Nose, Fundamentals of Myo and Airway Dysfunction. So if you can join us on the next webinar, it's Wednesday, April 15th, from 5:30 to 7:30 p.m., just like tonight.
We hope you will join us for some of our upcoming live CE presentations. Here is how to claim your CE credit. Scan the QR code or copy the link, fill out the quiz, and click Submit. Your CE certificate will be immediately sent to the email you provided. If you enjoyed this presentation, give us a like or drop a comment below. We are the Social 630, where CE meets community, and care goes beyond the Social 6.